The overseas doctor. A. Type of registration. To manage and treat patients in the UK, all doctors must register with General Medical Council (GMC). There are several types of registration. Provisional registrations is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limit registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training (CCT). The GP register is a register of those eligible to work in general practice in the NHS. Now, for full details of the General Medical Council, B. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in the UK hospital. Part 1 consists of a written test of knowledge, skill, and aptitudes. Part 2 is an objective structured clinical examination (OSCE). It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. See PLAB station advice. Clinical examination, your ability to carry out a physical examination of a simulated patient and actor trained to play this role will be assessed. Uncomfortable or intimate examination will be carried out using a mannequin and anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient, or in some cases, the examiner will be assessed. Skill tests may include reading bad news and giving advice of lifestyle. History taking. Your ability to take an accurate history and make a reasoned diagnosis will be assessed. Advice on the station from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Keep in mind safety precautions like throwing the sharps in the sharps bin. Don't forget the ABC airways breathing circulation protocol in every emergency station. Check the patient, understand what is happening, then ask them about any concern they may have. Don't just give a lecture. Listen carefully to what the actor says. El médico extranjero. Tipos de registro. Para gestionar y tratar pacientes en el Reino Unido, todos los médicos deben registrarse en el Consejo Médico General. Hay varios tipos de registro. El registro provisional es para médicos que acaban de graduarse en la Facultad de Medicina en el Reino Unido o que son de un país extranjero del espacio económico europeo. El registro completo es para médicos que han completado su formación clínica de 1 año. El registro limitado es para graduados internacionales de medicina que no han completado el equivalente a la formación clínica de 1 año en el Reino Unido. El registro de especialista es para médicos que han completado la formación especializada en medicina y tienen un certificado de finalización de formación. El registro de GP es un registro de todos los elegibles para trabajar en medicina general en NHS. PLAB. Antes de poder obtener el registro completo, se exige a algunas categorías de médicos extranjeros que realicen el examen PLAB. El examen PLAB está diseñado para asegurar que aquellos que aprueben pueden ejercer con seguridad el nivel de un SHO en un primer puesto en un hospital del Reino Unido. La parte 1 consiste en un examen escrito de conocimientos, habilidades y actitudes. La parte 2 es un examen clínico estructurado objetivo. Consiste en 16 estaciones clínicas de 5 minutos, también conocidas como estaciones para evaluar habilidades profesionales. Estaciones y consejos para PLAB. La OSC evalúa estas habilidades. Evaluación clínica. Su habilidad para llevar a cabo un examen físico de un paciente simulado, un actor capacitado para interpretar este papel será evaluado. Los exámenes incómodos o íntimos se llevarán a cabo utilizando maniquí, modelo atómico. Habilidades prácticas. Se evaluarán su habilidad práctica como suturar y poner inyecciones intravenosas. Habilidades de comunicación, su habilidad para interactuar con un paciente simulado, en algunos casos con el examinador será evaluada. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre el estilo de vida. Historia clínica, su habilidad para tomar una historia clínica precisa y hacer un diagnóstico razonado será evaluada. Consejos para las estaciones. De un candidato exitoso. Lea atentamente las instrucciones fuera de cada estación. Tiene un minuto para esto. No olvide el protocolo ABC, vías respiratorias, respiración, circulación en cada estación de emergencia. Tenga en cuenta las precauciones de seguridad, como tirar las agujas en el contenedor de objetos punzantes. Comprueba que el paciente entienda lo que está sucediendo, luego pregúntale si tiene alguna preocupación. No te limites a dar una charla, escucha atentamente lo que dice el actor. What kind of registration might these doctors obtain? A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year for registration. An SHO who has successfully completed the foundation program and gained a certificate or competition of training after several specially registered posts, specialist registration. Write the abbreviation in words. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional Linguistic Assessment Board. Part 2 of the test consists of an OSCE, Objective and Structured Clinical Examination. In any emergency, remember the ABC protocol, airways, breathing, circulation. Before you can certain specialist registration, you must have CCT, Certificate of Completion of Training. Completed the text. My name is Musa and I come from Yemen. I came to the UK about 2 years ago after graduation because Yemen outside the AET I could only obtain limited registration with the JMC. At first, it was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB to show that I could work safely in the UK. If I had to give some advice to other candidates, would be that a counseling station username simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get a show, posing my chosen specialty pediatrician as hospital not have to demonstrate the suitable candidate from the year. Once I complete my second foundation year, I should obtain a training CCT, which will allow me to proceed to completion of training with the GMC, an important step on the road to becoming a pediatric consultant.